Hey, how are you? My name is Dr. Daniel Davids. I'm a physical therapist and I run the Traveling Physical Therapist. We provide Medicare covered in-home one-on-one physical therapy in your area. Today I want to talk to you about arthritis, specifically osteoarthritis. That's the very common arthritis. And I want to give you a few facts and kind of dispel some of the myths. So here we go. The first thing you need to know is that it is completely unavoidable. If you live to be 250 years old, you will have arthritis in every joint in your body. There's nothing that can be done about that. There are things that can be done to prolong when the arthritis kicks in, and there are things that can be done once you have arthritis to make it less painful, but the only way to remove arthritis is to have a joint replacement. Now, I mentioned that there's things that you can do to reduce the pain, and that's because pain and injury are not the same thing. Arthritis is a chronic issue. It's going to be there forever, but that doesn't mean you're going to be in pain forever. So, we know that you can have a major injury like arthritis, which is not a major injury, or let's say a broken femur. Now, if you break your leg, which is the femur, the long bone in your leg, you can have no pain whatsoever when you're in a cast. The opposite is true as well. You can have very significant pain with very insignificant injury. For example, I love to talk about a paper cut. You get a paper cut, and that can be a 10 out of 10 pain, but it's not a severe injury. So what is arthritis? Well, that's going to be the degeneration of our joints, specifically the joint space where the two bones interact with each other. Now, if you think about breakdown, you kind of think about building a rut, or digging a rut, I should say. So if you're digging a rut, that one area that's been dug out pretty hard is going to become very painful. So what do? We have some tricks and some tips that are going to help you to not be stuck in that rut, starting with flexibility. Now, flexibility is very important, and it's the first thing that we have to do when we're dealing with arthritis. What are we stretching? Well, the most important muscles that we're going to be stretching are the following. The first one is going to be the hamstrings. The hamstrings live in the back of your thighs, and they help bend your knees. So I'm going to show you this stretch here, which is going to be lifting your leg up and holding it there for 30 seconds, making sure that the other leg is straight. I mentioned that you only do it for 30 seconds because the evidence has shown that if you do a stretch for 2 minutes or 5 minutes, there's no increased benefit. 30 seconds is the cutoff, and only once a day. So if you've been doing stretches for 10 repetitions at 45 seconds or 2 minutes, you're probably doing too much work. The next exercise I'm going to show you is a hip flexor stretch. Now with this stretch, you're going to have one leg off the table or off the bed, and the other foot is going to be bent and flat. We're going to hold this for 30 seconds. Now, if you want and you want to increase the stretch, you can use a strap like you used for the hamstring stretch and pull your knee a little bit further backwards. But it's important that you don't get too aggressive with this. The next thing I want to talk about is going to be strengthening. Obviously, strength is very important when it comes to arthritis. So, what muscles are we strengthening? Well, just like flexibility, we're going to be strengthening the most important muscles, the ones that are going to help us the most. The first one is called the gluteus maximus, or the glutes. Those live on the muscles of your tush. They help you stand up from a sitting position, and they help you bring your leg backwards. The best exercise for glutes is going to be a bridge. Now, when doing this bridge, you want to make sure that your knees are bent, your feet are flat. You can lift your toes up a little bit, but the point is you want to lift your tush up towards the ceiling. When you're doing this, try to tighten your tummy a little bit at the same time. This prevents your back from arching. If you have back pain, you know that arching your back can be quite painful sometimes. You want to repeat this exercise for 10 repetitions, take a break, and repeat that 3 times throughout the day. Now, you can always make that harder if you want, or you can make it easier if you need to, and there's different ways to do that. The next thing I want to talk about is your abdominals. Now, there's a lot of misinformation about your six-pack, your abs. Today, we're going to talk about something very simple. When you're lying down with both knees bent and your feet flat on the floor, you're going to bring one knee up towards your chest. Take both hands and put your hands on the top of your thigh. With your hands, you want to push your knee down, and with your knee, you want to push your hands back up. This is going to cause what's called an isometric contraction. There's no movement in either direction, but you're tightening up your tummy. You're going to hold this for 10 seconds and repeat this 10 times. Switch over to the other leg and do the same. The next piece of advice that I have is that it's important to stay active. We say move well and then move often. So how do we stay active? Well, it might be a little difficult to say walk for 20 minutes a day, but maybe you can walk for 10 minutes a day and then do some of these exercises for the other 10 minutes. Or maybe you could split up 5 minutes, 5 minutes, 5 minutes, and 5 minutes. The important thing is, even though our bodies sometimes say we're stiff, we don't want to move, it's important that we stay active. Very rarely is bed rest the answer. My next piece of advice is to try novel things. If you like to walk, try dancing. If you like to dance, try yoga. If you like yoga, try Tai Chi. The point is, no matter what it is you're doing, try something new. It has a lot of benefits. For example, you're going to be moving in a direction that's probably different than your usual. So if we go back to talking about being in a rut and digging a deeper rut, by trying something new, you're going to be moving away from that area that you're always running down. So lastly, my piece of advice, my take-home message, try physical therapy. It incorporates everything I just mentioned: flexibility, strengthening, staying active, and trying new, novel activities. Specifically, the traveling physical therapist. Now, we provide in-home physical therapy. The benefit here is tremendous. If you think about it, there's no waiting rooms, there's no travel time, you're one-on-one with your physical therapist the entire time. And we bring all of our equipment with us. So if you need to do an exercise and you don't have a piece of equipment in the house, we're going to leave it with you so that after you've been discharged, you can continue on and do the exercises that you need to do to get yourself better. Hey, thank you very much for listening. Do me a favor and yourself a favor. Click on that button down below and set up a phone consultation with me. I'd love to be able to tell you the best ways that you can help yourself individually. The advice I gave is advice for the general person, but you may have something more specific. Please give me a call. I'd love to set something up. Thank you very much. Have a wonderful day.